I'm VJ Hamilton and welcome to the Autoimmune Reset, the place for you to learn how to thrive with autoimmune disease and feel empowered to take steps to transform your health to feel better than ever. You can start making changes today to improve your health. So with every episode, my mission is to share with you simple ways to up-level your diet and lifestyle with key learnings from my own journey reversing autoimmune disease and inspirational stories from those who have reset their autoimmune symptoms and are now thriving in life. I suffered from autoimmune disease for over 25 years and now I live symptom-free, and I wish the same for you as well. So thank you for being here and sharing this time with me. Now let's get started. Hello and welcome to this episode of the Autoimmune Reset Podcast. I'm your host, VJ Hamilton. I'm a nutritionist, scientist, and expert in autoimmune disease. And today I'm very excited to have Dr. Jill Carnahan on the podcast. Dr. Jill is a functional medicine expert. She's also overcome breast cancer herself and had Crohn's disease herself, and we'll talk more about that today. She's the author of the book, Unexpected: Finding Resilience Through Functional Medicine, Science and Faith. So I'm so excited to have you here. We're going to be talking about a very complex area, which is mast cell activation syndrome, and I know you're an expert in that. So welcome, Dr. Jill. I'm so excited to have you here.
Thank you, VJ. I'm delighted to be here.
So shall we start with your own journey? Because most of the time when we are helping people with these types of conditions, we've been through something ourselves. So it'd be interesting to hear how you are now doing what you do.
Yeah, so I grew up on a farm in central Illinois, right smack dab in the middle of the US, and farm country, there's obviously lots of chemicals and pesticides. So unbeknownst to me, it was this really lovely, idyllic life. I was one of 5 children, but there was chemicals involved. And of course, with autoimmunity, that's one of those triggers. So I didn't really know that growing up. I, had a pretty happy, healthy childhood. I did suffer from asthma and allergies and eczema, which is in the mast cell bucket. So there is another theme that will come through, and that is I'm certain I had significant mast cell activation and had no idea. But went on to, I knew I wanted to help people and do a health-related profession and ended up in medical school and pursuing my dream of becoming a doctor in Chicago, Illinois. And in my 3rd year, right after my surgical rotation, I found a lump in my breast. I had literally just turned 25 years old the week before. And I, ended up having a biopsy to figure out what was going on. I wasn't worried at all. I was like, I'm 25. This is just a nuisance. I didn't have time to deal with it. But I remember getting the call from the surgeon, a few days later. And she said, Jill, I don't even know how to tell you this, but you have aggressive breast cancer. And even the school was shocked, and my doctors were shocked because at that time, I was the youngest woman ever diagnosed at that major medical university. So sadly, since then, there's been a lot of younger women that have been diagnosed. Now it's unfortunately not uncommon, but in 2001, when I was diagnosed, had the honor of being the youngest one ever diagnosed at Loyola University Stritch School of Medicine. So that began, my healing journey as far as as you can imagine, anyone who gets like a life-threatening diagnosis or something like that happens, you don't know if you have 6 weeks or 6 months or 6 years. And it was very aggressive. And so I fought it with everything they threw at me. I had 3-drug chemotherapy. I had multiple surgeries to get clear margins, and I had radiation. And I remember 9 months later getting done, I had no hair left. I was so sick from the chemotherapy. So I was bald, I was sick, I was, underweight, and my gut was destroyed. And that led to a later diagnosis 6 months later of Crohn's disease. So all of this and trying to find my way back into medicine and finish my, curriculum and my training. And I was in pretty bad shape, but I had survived and I got through it. And then just 6 months later, I started having cyclical fevers, more weight loss, diarrhea, abdominal pain, and I was doing an ER rotation, and I passed out one day and woke up with, being the patient again, and I was rushed into emergency surgery for an abscess, and the surgeon came out and said, Jill, you have Crohn's disease. So that was kind of my early, training in medicine, is becoming the patient and really trying to understand. And I think the thing that you, I'm sure, share this as well, and for sure for me, and it's curiosity. I always had a curiosity of why? Why did that happen? What happened here? And how could I, either learn from it or go on to change my course of disease?
Yeah, I mean, I've heard your story before, and it's always inspired me so much for you to go through all that at that age, still carry on studying, and just completely transform your life around. It's remarkable, and I hear a lot of these stories, but yours really stuck with me. And I've heard you on a couple of other podcasts, and I've seen you do other things, and I'm always like taken aback of that story. Just going through that one thing, if you were just going through one of those things, it would be hard enough. So when you were going through it, I mean, this curiosity piece, I think it helps, doesn't it? Because I think, as being curious, you're a questioner, you want to know the why. What steps did you take after that, and how did that lead you on to doing what you're doing today?
What a beautiful frame. And thank you for saying that. Because, sometimes I think back in the day, this was 20 plus years ago for me, I was slightly dissociated. Now I've done the work around that, but to get through that kind of trauma in med school and go right back and get into it, I don't know how you could not be a little dissociated from what was really happening.
Yeah.
And so I look back and I tell the story, I'm like, wow, that poor girl, she just like pushed so hard and she went right back to school and there was no break. And like I look back and I'm like, oh, sweetheart, I wish you would have taken a little more time. And I pause there because I think it's relevant to your autoimmune audience, because autoimmune at the core is attack of self, right? It's this metaphorical thing that happens. And breast cancer, I learned later from some of Gabor Mate's work, is a lot of times it's a nourishing organ, right? We're nourishing the new life that comes into the world as a baby from our breast and our breast milk. And so we're often metaphorically over-nourishing the world and giving and giving and giving and not
Yeah.
really taking care of ourselves. So those were lessons that took me 20 plus years to really learn and go into, but I think it's relevant. And I also just the kindness in you actually acknowledging the trauma and difficulty of going through any illness, whether it's your listeners or myself. That's a beautiful thing for you to say. So curiosity, I think one of the ways that we can take our own diagnoses and our own difficulties and the things that we face, and I'm sure many of your listeners are facing their own battle and challenges, if we can find meaning and purpose in the midst of the suffering. So if we can, and I think it starts with curiosity, because if we just like, oh my gosh, this happened to me, right? We're maybe a little bitter and we are sick and we're not doing well. But if we can remain curious and open-minded and say, this is not very fun, I will acknowledge the suffering, but maybe, just maybe there's something here that can help me grow and help me become a better doctor and help me become a better human. And so the curiosity starts with looking for, is there something in this that could actually be good?
Yeah.
Despite the horrific diagnosis, the difficulty, the suffering. And even now, it's probably the thing I most define as resilience is the ability to look at anything that comes our way and find a meaning and purpose beyond the superficial circumstance, because none of these things are fun. And I've finally come to the point at 20 plus years later to know that, gosh, I hope I don't have to suffer anymore. I really don't want to. I don't like to suffer. But I also know at the same time that part of my resilience is I pretty much, there's nothing that life could throw at me that I couldn't handle. I know I'm so confident now in my ability. And again, I don't like suffering. I might fall apart as a weepy mess on the floor still. But
Yeah.
I know that something inside of me is stronger because of this. So back to that curiosity, I think it starts with saying, what can I learn here? Why did this happen? And there's one side that's the psychological trauma piece that we're talking about. But the whole other side is, okay, physiologically, what happened here? And I realized that growing up on a farm, I was exposed to many types of chemicals like organophosphates and pesticides, atrazine for one, that have endocrine-like effects on the body, which means they have a hormetic or hormone-like
Mm.
effect on the body. And interestingly, people find this very fascinating that I was 25, breast cancer. I have a younger sister who's 7 years younger than me, and at the age of 28, she was diagnosed with thyroid cancer. So two
All
girls,
right.
same family, same farm upbringing environment, two endocrine related cancers. Now she's doing great too, but to me that's the curiosity. Okay, there's a pattern here, right? And there's something going on. And so as I started to learn more about the environmental toxic load and how that affects our bodies and cancer and autoimmunity, I realized as I teach on this all the time now, there's three big things that increase in incidence after toxic exposure. One is cancer, one is autoimmune disease, and the third
Yeah.
is neurodegenerative diseases. So it's really relevant.
Just seeing that pattern and going through your own health history, obviously that put the piece of the puzzle together. But did you do any other work at that initial stage, or what action did you take when it came to your
Yeah.
health?
So the first thing was I did realize probably within the first 2 years post-diagnosis that there was environmental things that had affected my diagnosis. And even though I'm talking about the cancer, I developed Crohn's 6 months later. And so that's also considered an autoimmune disease, and later Hashimoto's thyroiditis. And so it relates to autoimmunity very well. And so once I learned that, I started going, okay, what things in my environment, and things like air fresheners that are commercially based or cleaning products in our homes, all of those have a significant toxicity effect, and most of us just use them without even thinking. And then
Yeah.
for women and men too, all the things we put, I think it's over 200 chemicals the average woman puts on her body in a day. So makeup, bath and body products, lotions, shampoos, conditioners, all the many things we do to make our hair and our nails and our lashes and everything beautiful. All of those things, if we're not cautious and looking for parabens and phthalates and chemicals and perfumes and fragrance in those things that we put on our body, our skin is a massive absorptive organ. So I started to look at what I was using on my bath and beauty products, and I started to really change. And I remember thinking, this is overwhelming and expensive. And so I always give a lot of credit to people who are trying to change, because it takes some time and it is
Yeah.
cost a little more sometimes. And you can just bit by bit start to clean up things. I think it was probably 2 years till I really, really got clean on all of the products that I use.
Yeah, it does take time. And I think that's the thing when you talk about toxicity. I know I went to a health conference years ago and they were talking about this, and you shouldn't use this pan and you shouldn't store your
Yeah.
food in plastic. And it was all the right information. But I did go home and I was like, oh gosh, I'm really anxious about everything all of a sudden. But then I just thought, what am I using the most? What am I
Mhm.
putting on my skin the most? What am I
Yeah.
washing my hair with? What am I using to cook my food with every day? And just took, the main things and changed those first. And then I'm still doing it now. There's an
Yes.
app I've been using called Yucca, and you can just check your products on there. And as much as I thought quite a lot of my products were clean, I'm quite surprised. I want them to be in that green, good or excellent zone now. And it's just, again, like when I need to buy something new, I'm going to check it and make sure I'm getting something good. So you can do it slowly over time, can't you? And you don't want to put too much stress and anxiety on yourself at the same time.
I love that you said that, because I think I lecture a lot on environmental toxicity, and it is a very depressing lecture. And it can create a lot of angst with all of us, because the toxic load is astronomical, it's ever increasing. But I always like to go back to, like you said, just start where you're at. Start with maybe the lotion you put on your body. Start with one simple thing and have a success by changing that, and then knowing that you can keep going just little bit by little bit. Get rid of plastic containers in your kitchen, and then maybe stop microwaving your food, and just little things. And I always love to give very practical advice, in the sense of, I say this a lot, and it's clean air, clean water, clean food. So we can start with some really basic things and start to implement the strategies there. And it starts to feel a little bit less overwhelming.
Yeah, no, I love that. Keep it simple. And we can maybe talk around some of your advice around those three areas as well. But in terms of your health, were you ever affected by MCAS or, histamine issues? Was that part of why you started specializing in this? Or it might be similar to me with a lot of complex cases, and I find that MCAS comes up time and time again.
Yeah, so what I find is, so I had the cancer and the Crohn's, and then got well and did pretty well for many years. And then I was in Boulder in a practice, and I got mold toxicity from a water leak and a flood in Boulder. And so my office where I was practicing medicine became extremely toxic, and I got very, very sick. My eyes swelled shut. They had rashes. I had brain fog and congestion and lung issues and sinus issues and skin issues. And again, looking back now, things like allergies, asthma, eczema can all be in that bucket. So can brain fog, cognitive issues. And recently, as I was preparing to talk about mast cell activation, there is even evidence that an increased risk of solid tumors like breast, colon, and lung is also related. So when I look backwards at my story of the breast cancer and the Crohn's, I'm like, that was probably really a story of mast cell activation at the root.
Mm.
And so what I see with mast cell activation is there's always some genetic component, either too much histamine production, poor breakdown of histamine, intolerance to histamine, or any number of things that makes your load as a human higher or more difficult to tolerate. And it's histamine we talk about because people know antihistamines and histamine and congestion and allergies, but there are literally hundreds of chemicals that these mast cells throw out. So mast cell is your primordial immune cells that are kind of out there protecting you from the bad guys, the viruses, the bacteria. So they have a purpose. They're there for a reason. But what happens is, contrary to what we were taught in medical school about a condition called mastocytosis. That's a proliferation, almost like a precancerous condition of the bone marrow where there's too many mast cells being produced. We were
Yeah.
taught that in medical school, and most medical doctors know about mastocytosis. But this thing we're talking about, mast cell activation, is very different. There's not always any proliferation or increase in number of mast cells. They're just more aggressive, and they're throwing out their protective mechanisms, which is all those chemicals, prostaglandins and histamines, and many, many other things that can be even measured in the blood. And those are protective, but they also cause tissue edema, inflammation, permeability of membranes, so leaky gut, leaky mitochondria, leaky brain, all of those things. And so you have this latest consensus guidelines on the diagnosis of mast cell activation, which is again different from the old mastocytosis, which is considered
Yeah.
pretty rare. And now we're seeing mast cell activation much more common. So the diagnosis relies on you having multi-system, multi-symptom disease, meaning your lungs are affected, your heart might be affected, your brain might be affected, your gut. So this multiple systems, and then multi-symptoms within each system. So for example, I might have congestion and runny nose and sneezing and trouble breathing. That's respiratory system. I might have tachycardia, heart rate increase, or trouble sleeping. So that could be like brain, or so you're having different systems affected. And all of this is from the output of what that mast cell is throwing out. And it should go out there and fight an infection or fight a bad guy or fight an allergen and then calm down. But in mast cell activation, it starts to activate and perpetuate, and it becomes a real chronic issue. So you have this multi-system, multi-symptom diagnosis. You have a response to the things that control histamine and mediators like H1 blockers, H2 blockers. That'd be like, a Benadryl or a Pepcid, monoleucas inhibitors. And so all these different types of things that might help it. And that's also part of the diagnosis. So you have all these different things that are able to calm down the symptoms. And that's really how you make the diagnosis. So multi-system, multi-symptom disease with a response to the mediators. And then there are blood tests and different urine tests we can do. But often someone can have a significant disorder and those tests will not be positive.
Okay, that's quite interesting to hear, because I think what I find is mast cell activation syndrome, it's kind of recognised from a conventional medicine perspective, but not really, especially here in the UK. And clients will come to me and say that they have MCAS, or they've spoken to somebody and been diagnosed or been told that that's likely what they have. And for me, it's a little bit like somebody coming and saying they have IBS.
Yes.
It's telling me what their symptoms are, but not the underlying root cause. So why would somebody's body be acting in this way? I know you've mentioned the genetic piece. So it'd be interesting to understand why people's bodies are reacting this way, plus a little bit more about the testing and what somebody
Sure.
should be looking for with the testing.
Okay, so first thing I want to just confirm what you just said, and just so if you were listening, that you heard. So the new consensus 2, which is written in the papers, you can look it up online, is multi-system, multi-symptom, more than 2 systems involved with a response to the drugs and the treatments and the natural things that actually treat, with biomarkers, which could be blood and urine, and we'll talk about those. But like I said, you can have a multi-system, multi-symptom disease state with a response and no positive markers and still have the diagnosis. So that's how a doctor could diagnose it. Second,
Okay.
then what can you do to treat it, and why are these mast cells going to rise? So there is this genetic component that most people who have this disorder have a proneness for those mast cells to be a little bit more aggressive or a little bit more reactive. And then they kind of perpetuate themselves and spin down this spiral into where they're out of control sometimes, and they cause a lot of issues. I mean, even some people get so sick they can barely digest food because their gut is so permeable and their gut's so affected. Gut is affected, the heart is affected, the brain is affected, the skin is affected. You name it, pretty much any system could be affected. And so that's kind of what's happening. What I see in the root of functional medicine, which relates to mast cells, is environmental exposures like environmental toxic load plus infectious burden. Those are 2 of the really big kind of hidden triggers to mast cells. So what that means is if you get Epstein-Barr and you get mono, that could be a trigger for your mast cells to get irritable. COVID, we saw the pandemic, of course, years ago, and that just happened to be a virus that really, really triggered mast cells. So a lot of people post-COVID, either temporarily or for a while, will have mast cell activation just after they were sick with that virus. But it could be many other viruses. It could be chickenpox, it could be Epstein-Barr, it could be a tick-borne infection like Lyme disease or Borrelia or Bartonella, Babesia. So lots of infections can be triggers. Lots of toxins like mold. Mold is probably the number one trigger that we see for mast cell activation, but also heavy metals, chemicals, phthalates, parabens, polyfluorinated compounds, all these things that are in our environment, in the air that we breathe, in the water that we drink. So toxic load, infectious burden combine to create this immune dysfunction in those who are genetically susceptible. And then you throw in the gut lining and the leaky gut and the permeable gut and the issues with the gut. And what happens is, because that's our exterior environmental barrier to like our tube, which is our digestive tube to the outside world, when there's a permeable issue where there's leakage of the bacterial toxins in the gut or leakage of food particles from the gut because of, I always say it's like Swiss cheese for guts, if you have permeability or you have leaky gut, and then you're leaking this load of toxins from the inside out into your bloodstream, and that can also trigger mast cell activation. You can also have types of bacteria in your gut that are more histamine producers, so you can have production from the microbiome of histamine. You can have poor breakdown due to lack of certain enzymes, which means if you eat high histamine foods, you can't break down that histamine and you have symptoms. So it can come from inside out, it can come from your microbiome, it can come from your genetics, it can come from, so there's all of these things playing into that. And in the end, it ends up being, what's the load for that patient and how can they tolerate that load? And are their mast cells calm and like easygoing, or are they like aggravated bouncers at the bar? They're like, hey, you have no business being here, and they're kind of overreacting.
Yeah, I mean, there is so much to think about, isn't there? And I think there's also the stress piece, which is probably,
Yes.
kind of the foundation of all of this. But so where would you start with a client who has MCAS? Obviously, I expect you're doing you will be doing a full review and deciding which factor is probably the most significant. But at the same time, do you have a process? Do you work on the gut first? Do you think about viral load, toxicity? Where do you start? Because as a practitioner myself, it's tempting to go after certain things, but a systematic approach normally works out best.
Yeah, so I love that because this is more and more common. And you have to have kind of a high index of suspicion, which I'm sure you understand as well, because often those patients who are stuck or not getting well or have been to other practitioners and not had success, I would say 80% of the time, maybe 70, 80%, mast cell is at the root, at least as a part. So you have to suspect it first. Then you ask the questions, and then you look at the systems that are affected and, figure that out. And then you want to make a diagnosis. So we do test in our clinic things like serum histamine, tryptase, urine prostaglandins, and there's a whole list in that paper. Now, the difficulty with the tests that are involved in mast cell activation is these substances are very volatile and they're heat sensitive. So what happens is, say, for example, you get a urine sample at home. If that patient doesn't immediately put that urine on ice, get it to the lab on ice, and the lab tech keeps it on ice, if it gets the slightest bit warm, 5 minutes sitting on a counter, you'll lose that histamine or that tryptase metabolite or whatever you're looking for in the urine or serum. And so often it has to be very, very carefully collected, which can be a difficult thing for patients or for the lab. So that can make it harder to diagnose. And so usually what I'm doing is I'm also looking at limbic system, because the stress, the fear, all those things around it are part of the perpetuating because mast cells they're protectors, right? So if your body thinks it needs protection because there's something dangerous and because you're afraid of some issue or you have unresolved trauma, those things can play into it, because the mast cells are just trying to do their job and protect you, and they're a little overly aggressive because they think you're in danger. So that's one of the first levels. I'll always include some. I'm not an expert in therapy, but I know people who are. So I'll get them involved in some home therapy or online program or things like DNRS or Primal Trust or Gupta program. There's 101 medical hypnosis, neurolinguistic programming, all of those things, EMDR can be super helpful. So that in the background can help someone start to feel less unsafe in their environment. And then I always look for triggers, and mold is very commonly a trigger. So I'm going to check for mold. I'm going to check toxic load for other environmental toxins like metals, parabens, phthalates, pesticides, all those things. And then I'm also going to check infections. So I'm going to screen for any active infections or viruses that are reactivated, or maybe tick-borne, vector-borne infections, because all of those can perpetuate those mast cells. But I do feel, say you have mold and you have tick-borne Lyme disease and you have mast cell activation. Mast cell activation goes right to the top in order of operations, because you're not going to really be able to detox that patient or to treat any infections until you start to get the mast cells controlled. So trauma, limbic system important, a true diagnosis is important, and then you start down the path of treating the mast cell activation really at the core of your work.
Yeah, and I suppose because what I have seen anyway is clients will have gone to somebody, they'll have worked on the infection piece or worked on the mold, and actually it's caused them to be even worse in their
Yes.
reactivity. And they're reacting to everything, every food they're eating, they're walking into rooms, their eyes going puffy, whatever their symptoms are, they're just getting worse and worse. So how do you help clients to stabilize that mast cell response initially? What's your process? Because I know you use different medications, but also natural approaches as well.
Yeah. Okay. So I love this, and I love how you frame that because, just like you said, say someone comes in for mold toxicity, and a practitioner's like, "Okay, we're going to detox." In order to detox, you have to mobilize those toxins that are stored in your tissues out of your tissues back into the blood. Your liver and your kidneys start to filter that, and you excrete it in the urine and the stool and the sweat. But as you're mobilizing, you're kind of getting re-exposed. So if those mast cells are angry and aggravated and you're wound up, and you start to do a detox protocol, or you have a Lyme disease patient, they're like, oh, let's give you antibiotics and these herbs to treat that. Both of those conditions, you're actually stirring up the things that are triggering the mast cells. So you must start with the mast cell activation and calm that down and get that in somewhat of control before you start to treat the other two, because otherwise you're just stirring the pot and it's like a hornet's nest that's very angry. So how do
Yeah.
we treat it? So there's a ton of wonderful natural things. I think the first premise is I don't know of hardly any patients that will respond to one thing. So in this disease, you really need to layer an approach. And so as a practitioner, or if you're out there and you have this and want to talk to your doctor, it's important to realize most people need more than one thing to start to calm that down. And so we start with natural products, things like quercetin, stinging nettles, Chinese skullcap, quail egg, vitamin C. There's lots and lots of things, luteolin, that are natural and that are mast cell stabilizers. Quercetin probably tops my list of things that work well and is one of my favorites. But I'll combine those things and see. And some people will react to anything, right? So even a treatment that could be good for one person may make someone worse. So you're just trial and error. And then typically we start down the line of H1 blockers, H2 blockers, so things like Benadryl or Zyrtec or Allegra or Claritin, those are all H1 blockers. Ranitidine is an H2 blocker. And then we go down to line things like montelukast, which is a mast cell inhibitor, mast cell stabilizers like ketotifen, cromolyn, which can help on the gut level with the food reactions and things. And we'll just kind of layer those. Some of the extreme cases, you need some of those immune modulating drugs, which I don't love to use, but they can save people's lives. Or even steroids, which again, I don't love steroids, but in a severe case of someone who can barely eat or tolerate anything at all, so once in a while you need those big guns just to calm and stabilize the patient.
Yeah, with the view that you'll be working on the underlying imbalances in the long term. Yeah, well, that's sounds like such a good starting point for everybody to think about. And I know our time is coming up, and you shared some great information already. I suppose if somebody is going through this, whether they suspect they have MCAS, they might have just been diagnosed with MCAS. Where should they start? Where's a great resource for them to go to find out more about this?
Gosh, there is a ton out there, but just because I know my own website, I've written probably, I don't know, 10 to 20 blogs on mast cell and different pieces of mast cell, and it's all on my website. Again, you can find good YouTubes in that. Some of the leaders that have written and published research, like Tanya Dempsey, Theo Theorides, Lawrence Afrin. So if you're looking on PubMed and finds that there's lots and lots of good papers on that, and more podcasts like this one, are talking about it. So you can always search podcasts. And I know, like I said, I've probably done 20 articles and 20 podcasts at least on the topic.
Yeah, I'll link to some of those articles as well, because I know there's some people listening to this and they like the research too.
Mm-hmm.
If somebody is going through this as well, what can they expect? And I think it's a difficult question to answer, but it can be not just frustrating, but it can be really affecting your quality of life going through this. As I said, you're reacting to everything. It feels like it's a long road ahead. What advice would you give somebody going through this?
Well, that's where I love to be a poster child for this in a way, because I do believe from growing up, being born on the farm, probably from birth, I had significant mast cell activation, and I believe it was a piece of the puzzle with breast cancer, Crohn's disease, Hashimoto's thyroiditis, and all the things I've suffered, mold-related illness. And now I can travel, I can go around the world, I can do things, and I'm not stuck at home because of the mast cell. And one of the things I think we started, and we alluded to this, but I think doing the somatic work around feeling safe in your body cannot be underestimated, because that work will set the foundation for all of these things to be more effective. And nowadays, I mean, I do take quercetin most days, but other than that, I'm not on a bunch of medications. And if I get a mold exposure when I'm traveling, I know pretty quickly what to do to reverse that. So I guess I'm just coming with a lot of hope that you can have a very full, beautiful life and overcome this. It can be complex and it can take some time. But if you go to the root cause, you find things to stabilize, and you work on your own somatic work and limbic system, I think it's very possible to overcome it almost completely in a way that you can live life very fully.
Oh, that's great advice to share. And would you mind me asking if there's any kind of lifestyle practices that you're doing every day? I was going to ask you about the supplements, but it sounds like you're not, just you're having the quercetin but nothing else. Are the practices that you do every day to keep yourself feeling amazing?
Yes, I do take supplements, lots of them, like B's and basics, right? But I actually don't mean to say that I don't, but for mast cell itself, I
Yeah.
only take a few. But so I take a lot of supplements, but I do have a pretty good routine every morning. I wake up and I sit and meditate on my PEMF mat with red light therapy, and I'll often do just salt water or electrolytes or methylene blue to kind of enhance that red light. Sleep is foundation. I am very strict about my sleep quality and when I go to bed and getting good sleep, because I know that that's such an important thing. I think things that are underestimated are, I take a walk almost every night by myself, listen to some music. So just that quiet time in nature, sometimes barefoot if it's nice outside. Connections and friendships matter so much. So feeling connected, and more than ever before in our, online society, really making sure we have those connections and friendships and relationships. And you can do all these fancy red lights and things, but you really want to make sure the core, clean air, clean water, clean food. So I filter my air in my condo. I eat as clean a food as I can possibly get. I drink filtered water, and I get good sleep.
In terms of sleep, I mean, that's great advice, but what would you say the main things are that help your sleep? Because I know so many people struggle with it. Is there any particular supplement, or do you have like a good routine, like bedtime routine that helps?
I do. I take an Epsom salt bath every single night, even if I'm traveling anywhere I'm going, as long as there's a bathtub. I order in. But I was in Switzerland recently, and I asked the hotel, can you please get Epsom salts to the room for me? And they did. And so it's like, Epsom salt bath, what happens there, and other people may not find it as useful as me, but when we increase our body temperature before bed, that cooling effect that our body has to go through after a hot bath is actually really enhancement for inducing sleep. And then things like the PEMF mat on a low level, like the Schumann frequency, which is 7 or 8 hertz, it's the same as if we were walking barefoot on the Earth's surface. That can induce kind of a calmer, deeper sleep. So often before bed, if I've had a stressful day, I will lay 20 minutes on my PEMF mat. But if you don't have those fancy devices, a bath, making sure you have dark shades so you don't have the light coming in at night, making sure your eyes see the sunlight within 10 minutes of wakening. If the sun is rising, that whole thing will actually help your circadian rhythm as well.
This is great advice, and I can see you today looking so fresh and vibrant. So what you're doing is definitely paying off for you, especially given everything you've gone through. You have a movie as well, don't you, called Dr. Patient at drpatientmovie.com, which people can access as well. Could you tell us a little bit about that?
Yeah, so my book came out in 2023, and as I was doing the final edit of the book, we had a production company come and say, we'd like to do a movie on environmental toxicity. And then they read the story, my own story and journey, like, we need to kind of feature you. So we ended up doing a documentary about my story and the story of 3 patients that we followed with similar issues, one with breast cancer, one with Lyme disease, one with mast cell activation. And the documentary is just to really bring to life what it is like to struggle and to overcome, and to realize that there is hope in the midst of any complex or chronic illness. So to me, it was just a labor of love. It wasn't a profitable thing. It was just about bringing that hope to the world so they could actually see in a visual sense of how to overcome.
And also, where can people find you if they want to find out more about what you do and how you help people?
Oh, thank you. Well, Instagram is great, Dr. Jill Carnahan, all kinds of things there. And then my main website is just my name, jillcarnahan.com, and it has a podcast and blogs and all kinds of free resources.
Great. Oh, well, thanks again for being on the podcast. And yeah, hope to catch up with you again soon.
Thank you, VJ.
Thank you very much for joining me today on the Autoimmune Reset. I really hope you enjoyed the discussion, and be sure to subscribe to the podcast so that you never miss an episode. And if you liked it, I would hugely appreciate a review on iTunes, as it helps me understand what you like about the podcast and to help share the information with more people. I'm excited to speak to you next time. And remember, you have the power to take the reins on your health. So keep the faith and celebrate the small wins. Until next time.